Good morning, everyone. We are the Group 4, and today we will present our case analysis on a growing but often overlooked health issue in the Philippines, HIV. The country now has one of the fastest rising HIV infection rates in the Asia Pacific. From 189 cases in 2023, the number expected to double by 2030. As March 2024, 55 Filipinos are diagnosed daily, mostly young people and men who have sex with men, making up over 80% of the new cases. Yet, only 64% of those diagnosed receive treatment. Barriers in access and support worsened the COVID-19 pandemic continue to hold back our progress, issues we aim to explore today.
There are several root causes behind this growing epidemic. Let's break them down. Number 1 is stigma and discrimination. Many people living with HIV face rejection from their communities, families, and even healthcare providers. In particular, individuals who belong to key populations like MSM and transgenders are often labeled as immoral due to dominant religious and cultural beliefs. This leads to fear, isolation, and reluctance to get tested or follow treatment. As Edison notes, this stigma is one of the biggest reasons why people avoid seeking help. Number 2 is limited access to education and services. Sexual health is still a taboo topic in many Filipino households and barangays. Because of this, many young people grow up without proper knowledge about HIV prevention, safe sex, or access to resources like condoms and pre-exposure prophylaxis. Many barangays don't even have local HIV service hubs. Services are concentrated in urban areas, leaving rural communities underserved. Third is the lack of solidarity due to conflicting beliefs. Public health efforts like the RH Law and SOGI Bill are often met with resistance by religious institutions. This leads to a confusing and inconsistent policy environment. While some advocate for reproductive rights and LGBTQ+ protection, others argue from a faith-based standpoint, making it harder to move forward with inclusive and effective health policies. Number 4 is the rise of online dating and social media platforms. The digital age has made romantic and sexual connections more accessible. Unfortunately, this also means that risky behaviors like unprotected sex, casual hookups, and multiple partners have increased, especially among the youth, leading to a higher exposure to HIV. And lastly, funding limitations. Funding is a major issue. A large part of the country's HIV response is funded by international aid like the US aid. But as of early 2025, potential US executive orders may cut back this funding. Locally, budgetary allocation to COVID-19 has also reduced support for HIV programs.
Our research revealed 6 key themes that define the HIV landscape in the Philippines. The Philippines as an epicenter. Our country is not just experiencing an HIV crisis, it is now considered the fastest growing HIV epidemic in the region. Pervasive stigma and discrimination. Across communities, religious institutions, and even schools, stigma and shame continue to silence important conversations about HIV and sexual health. This keeps people from getting tested or treated. The crucial role of youth. Youth are not just victims, they are also change makers. Grassroots campaigns, youth councils, and student-led organizations are crucial in spreading awareness, especially among fellow young people. The dual nature of religion. Religion has both helped and hindered HIV response. While some faith-based groups provide emotional and spiritual support to PLHIV, others have resisted laws that protect LGBTQ+ communities and promote contraceptive use. Call for enhanced accessibility. There's an urgent need to increase access to HIV education, services, and treatment, especially in far-flung or underserved communities. Multi-sectoral approach. Solving this crisis is not a job for the government alone. We need collaboration among NGOs, health institutions, religious groups, schools, and private sectors to sustain and strengthen our response.
To guide the country's response, several laws and proposed policies are in place. First, we have Republic Act 11166, the Philippine HIV and AIDS Policy Act of 2018. This law enhances access to testing, treatment, support, and protection of the rights of people living with HIV. It also strengthens the Philippine National AIDS Council's role in policy development. Next is Republic Act 10354, the Reproductive Health Law, also known as the RH Law. This ensures access to family planning services and evidence-based sex education in schools. It promotes safer sex practices, a crucial part of HIV prevention. We also have Republic Act 11313, the Safe Spaces Act, also called the Bawal Bastos Law. This protects individuals, including LGBT+, and people living with HIV from gender-based harassment and discrimination, both in public and online. And finally, the SOGI Bill. This proposed bill aims to prohibit discrimination based on sexual orientation and gender identity. Unfortunately, it remains pending in Congress, but its passage is vital to protecting those most vulnerable to HIV. These efforts align with global frameworks such as Sustainable Development Goals 3 and 10 and the United Nations Universal Declaration of Human Rights, which call for universal access to healthcare and promote and protection from discrimination.
The HIV crisis brings together different groups with unique roles and views. Real HIV continue to face discrimination, but their voices are crucial in shaping policies and raising awareness. Youth leaders, trained through programs like those by UNDP, are stepping up as local advocates. Traditional communities often help during health emergencies but may resist reproductive and LGBTQ+ policies. Government agencies like the DOH and PNAC are responsible for delivering HIV education and services. NGO, both local and global, offering fundings, campaigns, and support programs. Lastly, hospitals and research centers such as San Lazaro and RITM lead efforts in treatment and scientific response.
The HIV crisis in the Philippines brings a range of serious and interconnected impacts. Socially, people living with HIV or PLHIV continue to experience intense stigma and discrimination. Many avoid getting tested or seeking treatment out of fear of judgment, which delays diagnosis and increases the risk of transmission. In some cases, even healthcare professionals display bias, compromising the quality of care. Sex education also remains taboo in many Filipino homes and schools, making it difficult for young people to learn about HIV prevention. Ethically, our situation challenges our moral values. When individuals are denied services or treated unfairly because of their gender identity, sexual orientation, or health status, we must question our society's commitment to equality and human rights. Republic Act No. 11166 aims to promote dignity by ensuring confidentiality and prohibiting discrimination, but gaps in implementation remain. Economically, HIV treatment and prevention require substantial government funding. Budget cuts and irregular supply of antiretroviral therapy or ART led to treatment interruptions, which not only harm the health of PLHIV but also increases long-term healthcare costs. A growing number of sick individuals places a heavy burden on our already stretched healthcare system. Environmentally, while HIV isn't caused by climate change, natural disasters such as typhoons, floods, and extreme heat can disrupt access to life-saving medications and healthcare services. During emergencies, PLHIV may lose contact with support networks or face difficulty traveling to clinics, worsening their condition and increasing vulnerability, according to Ginto et al. 2022. For students can take an active role by leading peer-led HIV awareness campaigns in schools and local communities. Attending workshops like UNDP's Youth HIV Leadership Programs builds knowledge and advocacy skills. By using social media to spread inclusive messages and share real stories from PLHIV, students help reduce stigma and create a supportive environment. Encouraging friends to get tested and use PrEP or condoms promotes safe and responsible behavior. For the people, everyone can contribute by offering compassion and emotional support to those living with HIV. Sharing accurate information helps correct common myths and ends the silence around the topic. Supporting community-based HIV programs and practicing safe sex, even when it challenges traditional beliefs, are important steps. Being cautious with dating apps also prevents risky behaviors. For the government action is vital. Full implementation of RA 11166 and RA 10354 ensures strong education, access to services, and legal protection. Passing the SOGI bill can strengthen rights for vulnerable groups. The government must secure stable HIV funding, expand access to PrEP and testing centers, and promote telehealthcare. Collaborating with NGOs and faith groups balances public health and cultural values. Catholic Social Teaching, or CST. CST opposes artificial contraception, promoting abstinence and fidelity instead. It emphasizes that sex should occur within marriage and upholds the sanctity of life and family. However, it also calls for compassion and supports for PLHIV, encouraging communities to care for them with dignity and love. Balancing church teachings with public health is key to a holistic response.
As we conclude our presentation, the rising HIV cases among Filipino youth highlight an urgent need for action from all sectors: students, communities, governments, and the church. By promoting awareness, fighting stigma, and improving access to education and healthcare, we can protect lives and support those affected. Grounded in compassion and guided by the Catholic social teaching, we must work together to create a future where every young person is informed, safe, and valued.